ultimate goal is a good life all the way to the very end, no matter what happens along the way.
We were able to handle what was going on much better because we had Dr. Ragland and her team treating us as well as my mother.
The team gave me an extra layer of support that I just didn't have.
What they did was they didn't just treat the one person in the bed. They provided the tools, the knowledge, and the emotional support that I don't think you would have gotten without a palliative care team.
For me personally, I'm most proud of being able to provide the kind of care that I would want for myself or my loved ones.
Dr. Julia Ragland has been director of Newton-Wellesley Hospital's Palliative Care Services since the program was established in 2010.
So the mission of our service is to support patients who are hospitalized at Newton-Wellesley who are experiencing serious and progressive illness, to support them to have the best quality of life possible. We also provide support for their families.
What began 6 years ago with a team of just 3, a doctor, chaplain, and social worker, has now expanded significantly to meet the growing need.
We've grown so that we now have 3 physicians, a nurse practitioner, soon to be 2 nurse practitioners, a social worker. We collaborate closely with the spiritual care department. Through the course of a year, we average about 450 new palliative care consultations.
I was running around from hospital to hospital. I was trying to figure out what to do or what was best to do. And I just felt really on my own with it all the time. And Julia stepped in and really made me feel like somebody else was there to walk me through the things that I didn't understand.
Rhonda Hanley's mother was a career nurse who dedicated her life to helping others. Last year, she needed loving care in her battle with a rare disease. Rhonda is grateful they found Newton-Wellesley Hospital's Palliative Care Services.
They were the first ones to really look and say, okay, this is a very painful syndrome and we have to get it under control. My mother went from being really crazy with the pain, I want to die, I don't want to do, not her at all, to being okay again and being herself again. And it gave us 2 months of her being herself again. It was really big for us. To not have her die depressed and sad and in agony was big. Yeah.
My mother was born in Prague and was a Holocaust survivor. And over the course of her early life, there were a number of times she had to start over, and each time starting life over, the stakes got higher and higher.
In spite of her tragic early years, Hannah Krasa loved life and valued her family above everything. When cancer brought her to the end of her life last year, she and her family were well taken care of by Newton-Wellesley Hospital's Palliative Care Services.
The toughest thing I've ever done in my life is watch my mother disintegrate before my eyes. But just the care and the support that they had there, even if I saw them in the hallway, they would stop and answer a question. You just can't put a value on that.
The delivery of palliative care is really to be able to deliver the best care possible to patients and their families, because not only are we treating physical distress, but emotional distress, spiritual distress, and it is just really so gratifying to be able to take care of the entire patient and family and not just one specific aspect of their illness.
A team of people in white coats came in the afternoon and said, "You have pancreatic cancer."
That dire diagnosis last August came just 3 days before Mike Milo was to marry his sweetheart, Kathy Cunningham.
In palliative care, when we meet a patient, often what we do initially is pain and symptom control. So we were fortunate that we were able to get Mike's pain under control within, I would say, a day or so.
The wedding went on as planned, and through careful pain and symptom control that allowed for aggressive treatment, this love story has a happy ending.
We received the surprise of our life in February when the surgeon looked at the CT scans from early 2016 and said, for the first time, your tumor is actually small enough and has moved away from major arteries that I believe I can remove it. So that was wonderful.
Right now, as a palliative care service, we don't have the staff and the means to be in the cancer center as much as we would like. The hope for us would be to be able to do this on a regular basis, because it's a very important part of someone's complete care when they're faced with a serious illness.
I just want to thank them all at the Newton-Wellesley Palliative Care team for really taking my mother under their wing and taking care of her like a human being, and treating her as if she was as important as their own mother. I mean, that's all anybody wants.
They need the support they can get in order to provide this for as many families as they can. It's crucial. I can't begin to tell you what it did for our family. It really was an amazing, amazing resource to have.
The key thing we have to understand is wherever we are in life's journey, people have priorities besides just living longer. We have things we want to live for. And palliative care is about the idea that we can make sure that medicine improves your quality of life as well as your quantity of life.
As a community hospital, Newton-Wellesley Hospital is committed to caring for the health and well-being of our patients and their families throughout all ages and stages of life's journey.